I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good evening, everybody. Dee, would you please take the roll?
Director Wallace.
Present.
Director Stewart.
Present.
Director Nicholson.
Present.
Director Epen.
Present.
Director Danielson.
Okay, at this point, Kimberly, would you please introduce our guests?
Yes, we're very pleased tonight to have the 4 representatives from 4-H and the Future Farmers of America to talk a little bit about the Alameda County Fair Junior Livestock Auction. I'm going to ask Chris Henry to come up and give a little bit more of an introduction.
Thanks, Kimberly. As you know, Washington Hospital has been a big supporter of Future Farmers of America and 4-H over the years, and every year, right about this time, letters start coming to the hospital from these young men and women who are participating in the auction in the coming year. This is an incredible program and really helps develop these people into really remarkable young adults. It teaches them responsibility. These kids, while they're raising their animals, aren't playing video games all day. They're out before school and after school, taking care of their animals, training them, making sure they're healthy and well fed, and preparing for the various shows and then finally the auction that they participate in. It teaches them business skills. They have to keep track of their costs and understand when fair time comes what it's going to take for them to break even or make money on their project, which is the ultimate goal. And it teaches them leadership skills. You know, when I pick up the phone and call any of them and ask them, are you interested in doing a presentation for the board? I don't have to twist their arm. They jump at the chance. And so they're here tonight to talk about what they're doing this year and the upcoming auction. You know, just one thing that gives you a sense of who these folks are. I think I mentioned this to you the last time they were here. The Friday before the auction, I schedule appointments. They each get a 10-minute appointment to show me their animal and tell me why I shouldn't buy it. Usually it's why. I had 35 appointments last year. And I have 5 minutes between appointments to get from one place to another. Out of all 35, not one of them missed their appointment. Not one of them was late for their appointment. They were all there waiting for me and ready to go, and they stuck to their 10 minutes. And this is what this program teaches these folks. They're really responsible young men and women, and they're our future. So with that, I want to invite you guys up to the podium to do your presentation.
Okay, so my name is Bonnie Crawford. I'm from Sunol 4-H and Livermore FFA. I've been showing livestock, mainly cattle and hogs, since I was 9. I got involved through my mom and my sister, and I plan to graduate from Chico and major in ag business.
My name is Jenna Vieira. I live here in Fremont, but I'm in Sunol 4-H and Redwood 4-H, and I've been in 4-H for 12 years, and I've been showing pigs for 9 years. I got involved with it actually through Bonnie and a couple of my other friends that were doing it, and I was like, that's really cool, so I wanted to do it too.
Hi, my name is Ross Illingworth, and I am in Livermore FFA. So I started when I was 9 years old. My family helped me do livestock or whatever, and I run track and cross country for Livermore High, and yeah, that's about it. So thanks.
Hi, my name is Braden Illingworth. I'm 13 years old, and I'm in Abbey 4-H, and I started showing when I was 9 years old, and I basically been in this since I was about 7 years old, helping my brother, and so yeah.
Hi, my name's Haley Badalini. I'm 16 years old. This is my 4th year in the Abbey Swine Project. I have only shown hogs, and I started because both my parents were in 4-H.
Okay, so previously stated by Chris, each day one of us, mainly all of us, wake up every morning. We feed our projects, whether if it's swine, sheep, goats, or whatever we're raising. And then we go to school, do our hard work there, and then we continue the hard work when we get home. We do get help from our parents and loved ones, but through those experiences, we learn many leadership skills, and working with one another and our parents or whoever is willing to help us, we learn teamwork skills. It takes a lot to actually get some of this stuff done. We learn problem-solving skills through our business management, or whether or not we have to set our alarms to wake up. So through all experiences through 4-H and FFA, we learn hands-on experience, like you get hands-on agriculture. It can be anywhere from planting a strawberry in your FFA classroom for a project that's due Friday, or having to go and feed your steer. So through those experiences as well, so we have those on our plate, and then we always have to do our day-to-day skills. And all of us are students, so we do go to school. Some of us have a job. So we have to manage our time very wisely, and we learn those skills pretty quick so that we can apply them in the future.
So, as Bonnie was saying, by doing this, we're taking on a lot of responsibility. 4-H, mainly the large animal section, is for 9 to 19-year-olds, which is a big age gap. But when you're 9, you don't really want to wake up early to go feed your pigs, but you have to. And so it's just starting responsibly really early. And I feel like that's really great for kids because it's teaching them to have fun, but also to make sure they know that they have to take responsibility for what they're doing. So if they want to do it, they have to know that they have to put the work in to do it. And eventually they end up loving it and love waking up to feed pigs, even though they might not all the time. But sometimes it's worth it in the end. And also, like she was saying, problem solving. So if your pig's sick or if your goat's sick, you need to notice that right away. And if it is, you have to think, okay, like what are the symptoms, what's wrong with it, and how to fix that. So do I need to give it dewormer, or do I need to give it some other vaccine to help it, and what do I have to do to get that? I have to get a vet out to look at it and make sure it's okay. It also gives you a lot of self-worth. You're getting this animal from when it's very young, and you're still young yourself, and you have to raise it up to be big enough to sell, and you're putting all this work and time, and sometimes you don't like it because you're angry at them, and sometimes you love it because they're cooperating with you, but in the end it's all worth it, and you can look at this project on the auction block and think, like, wow, I did that, that's mine, and I did it all by myself, with some help from parents, of course. But mostly it's all you and like putting your time and your work into that, which makes it feels really good.
Alright, so I want to talk about the my breeding project for swine. So me and my brother have about 30 sows, and so every morning we go and feed them. They all have their own feeding stalls, and they have a hoop barn and all that stuff. And then to get them bred for the fair, we use our boar. I usually collect him, and I AI him. And then so kind of like 2 weeks after we breed the sows, we'll put the boar in there to heat check to make sure to see if they're in heat or to see if they're bred, and you'll start seeing if they have bellies or not. And then the pigs for our fair, for Alameda County Fair, the pigs are usually born December, and what I do is I farrow all the pigs. Every sow that comes in the crate, I'll help them farrow, and I'll make sure they're okay and not sick. And a couple of weeks or 2 days after they're born, I'll go and process them. That means ear notching them, cutting their tails so they don't chew on their tails, and then I'll also give them medication and like for anything that's sick, I'll go in the pens and I'll make sure if they're sick, then I'll give them some medication, whatever they need, and then that's it. And then my brother will talk about jackpotting.
Hi guys, so this is how you raise a show pig for the Alameda County Fair or whatever fair you're raising it for. So first you need to buy the pig, that's the most important thing, and then you need to sit in the pen with the pig. So that means having the pig get used to you, so like chew on your boot or something, so like they don't, I don't know, so they're not stubborn or anything. Then maybe 2 weeks before, or no, 2 weeks after, you need to have them, so you need to walk them outside. And so this is where the training comes in. So to train them, we walk them and we put their heads up. So that means putting the show whip, so the thing or the stick that you guys see us show with, it's called a show whip. So that's like a elastic stick thing with a little pointy tassel kind of and then you hit them with that and they go. And then so to put the heads up, you put the whip next to their chin, and they might do that, but it takes a lot of work. And to train them and exercise them, to train them and exercise them, so to train them, you put their heads up, you see if they're walking okay. You don't want them to turn around and go back to their pen, because that's bad. And to train them so they don't be stubborn in the show arena, and so they don't, so they're not stubborn, or they can't walk, or they just run all over the place. So you want like control of your pig. So the next thing I'm going to talk about is we shave our pigs to go to the fair so they look nice, so their hair is conditioned and all that stuff. And then when it gets hotter, 30 days before the fair starts, we wash our pigs and condition their hair so they look nice and shiny for the fair and the judge and the show and all that stuff. And then we weigh once a week, so we keep track of every weight, and we have a spreadsheet, and we keep track of every weight. So if this pig is gaining 2 pounds, and so we want to know how much they will weigh at the fair. And so the next thing I'll talk about is the accomplishments that we do at the fair, or that we have won. So the accomplishments that me and my brother have won: in 2014, we got Supreme Champion at the Alameda County Fair, and my brother got Reserve Supreme Champion at the Alameda County Fair. We got Reserve Burke at Sacramento State Fair, and then there's people who bought our pigs who has done pretty good with them. Just today we got Reserve York at Porterville County Fair, and our best, probably our best placing ever, we go to a show called Arizona National. I mean, we didn't take the pigs, but we sold the pigs to these 2 young men, and they showed them, and one got Reserve Supreme, one got Supreme, and that's a pretty big show, and they both sold for $26,000 at the auction. And last year for our fair, my brother got reserve crossbred and reserve hamp, and 2 pigs that we sold. One got Campion York and one got Campion Burke. And we've done some other amazing stuff. But yeah, so thank you guys.
Okay, so these are more pictures of their operation and some of their sows. And then, Brayden, do you want to talk about this one?
So this is the one with the bars across. That's their feeding stalls, and every morning they come in and eat there, and then they come out when they're done. And then the one with my brother in it, that's our feed shed. We keep all our feed in there, and that's where we mix all our feed and all that. And then this one right here, that's 4 of our show pigs that we're going to be taking to Alameda County Fair this year. And then the one up there is one of our sows that we have. So, yeah.
So I'm going to talk about my personal experience and how important it is for you all to help our projects. So, over the years, I've grown as a showman and have learned the value of hard work. Outside of showing swine, I played many sports for my high school, including soccer and water polo. Not only is the swine project about selling and showing your animal, it's about educating the public and our peers about this process. This is not always the easiest process, but each and every 4-H and FFA member puts in a lot of time and heart and commitment to caring toward their animal to succeed. Over the past 4 years, you, Washington Hospital, have supported me in my project. Year after year, you all continue to support me and many other 4-H and FFA members with our projects and learning responsibilities. I'd personally like to thank you all for your amazing dedication to the showman community. Not only is my passion for showing so strong, but with your help, I've been able to successfully earn profit. This money is greatly appreciated and saved to attend my dream college, SDSU. I hope to continue my amazing 4-H experience with you for the next 2 years till I graduate. Meeting and personally getting to know Chris Henry and his family over the years has been not only a great opportunity to learn about Washington Hospital, but also to learn about him as a compassionate person who greatly cares and is dedicated his time in helping the market show community. I know that I am just one of many showmen that you support, and it's an honor to be here talking to you about the 4-H process. I hope to see you supporting us again at the 2018 Alameda County Fair auction, where on July 8th, I and the rest of my fellow showmen will be selling our beautiful animals. Thank you all so much again for your support, with your help in making the 4-H community stronger.
Okay, like I said previously, my name is Bonnie Crawford. My story is actually really involved with your guys' CEO, Nancy Farber. She was actually my neighbor. I was born and raised in Sunol, and she saw my sister walking her swine project up and down our driveway, and she pulled over and said, "Miss, what are you doing?" And she was confused at first, but my sister, she's very intelligent, and she took that opportunity. And my sister is truly the reason that we're here today. She got Washington Hospital to start supporting the whole program. And truly, I really appreciate that, because not only has she affected many others, she's affected me, and so have you guys. So last year, I was lucky enough to have the Supreme Champion steer at the Alameda County Fair. And you guys generously purchased from me, and all of that profit will be going into my college fund, so yay me. So I'm going to be talking about more of the extra stuff. So raising our projects, we do a lot of jackpotting, and I know we previously might have said the word jackpotting, and what that is basically a show for any species. And it's like a mini fair. There's no auction, but you compete, you do the market class, which is basically about your animal composition, and then how well you work with your livestock, which is showmanship. So throughout the year, I personally try to attend at least 3 jackpots, as well as my extracurriculars. So I'm on the Livermore FFA livestock judging team. We compete through March all the way until May. Last weekend was our state finals, and we placed the fifth high team, and I was 6th high individual. So it's very difficult balancing, but it's possible. And it's possible because all the support you guys have given us, and as well as myself. 4-H and FFA have a huge impact on all of us. And I know FFA is a little bit cheesy, but Future Farmers of America, we are the future. And truly, agriculture is starting now. It's been around, but our generation is starting now. So the more education the public gets through the auction or presentations or just simply going out and just talking to people, it's a great opportunity, as well as the speaking competitions. So mainly the speaking competitions I've participated in have been through FFA. There are many through 4-H as well as through school for the ROP program. So all of these experiences build up and they build character and they build self-worth, and this program would not be funded without you guys. You guys participate in a huge portion of the livestock auction, and I want to commend you guys for that because it's truly appreciated. None of these kids go home not wanting to just explode with just overjoyment and just appreciation. So I just really wanted to appreciate you guys and just thank you for what you guys have done, and we hope that you guys still want to participate in the future with us.
So I wanted to talk about the influence that 4-H has had on me as I've grown up through it. Sadly, this will be my last year showing because I'm a senior and I'm going to be graduating in 2 weeks. So when I started out in 4-H when I was 5, I started with small animals, and every little girl wants to grow up to be a vet. Almost every little girl. So I was one of those. And then I got to 4-H and was working with my rabbit, and I was like, this is really cool. It's so cute, it's fluffy. And then I got to large animals, and I didn't really realize how much of a large animal thing we had in California, but we have a lot of large animals here. And one thing that we don't have a lot of are large animal vets. And so that's what encouraged me to want to become a large animal vet. I realized there was a need for them, and I really liked working with the larger animals. They're more sturdy, so you can fool around with them a lot more, and they're just more interesting to me because there's a lot more going on. So that was what really set me off to want to be a large animal vet, and ever since then I've been working really hard. I've had above 4.0 GPA for all of high school, I believe, except for freshman year. And I played two varsity sports, and was doing all of this, maintaining grades, and working with, 1 year I had 7 animals. That's a lot. It was a lot of work, but I enjoyed it a lot because I just love the whole idea of working with animals all the time, and I really want to do that in my future. And so one thing that 4-H really helped me with was college acceptances. I applied to 7 colleges in 6 different states, and I got accepted into all of them, including Penn State, UC Davis, and Colorado State. But I've decided that I'm going to go to Cal Poly San Luis Obispo because they have a good animal science program there, and they have enterprises, which are little 2-unit classes that I can take where I get to actually work with the animals. So even though I don't get to show anymore, I still get to be hands-on. They actually have one of the only Iberian pig populations, which is a smaller species that is newer to America. And so not only do I get to work with the pigs and still be involved with animals, I get to do research on this species that no one really knows much about. They're using them for diabetes research, actually. So it's kind of a 2 thing. I get to work with pigs and have fun. I get to do something that could help humans in the future. And I still get to do that hands-on work that I love to do and will really miss after this year. But so having you guys purchase our animals is really helpful for giving us that money to go towards college. A lot of the money that I get is going towards college so that I can have that experience. And hopefully in 8 years I'll be a large animal vet, hopefully in this area, maybe somewhere else, but somewhere I want to be helping, and especially helping 4-H kids because I know how much it meant for me, so I want to do the same for others. Thank you.
Okay, so as you guys have learned, you guys have impacted our lives tremendously. So upcoming on Saturday, July 8th at 8:30 a.m. is going to be this year's Alameda County Junior Livestock Auction, and we would really enjoy it to see one of you guys come and see our animals. We'll definitely be willing to work with Chris, and more than willing. So we would really like to invite you guys, and thank you for having us again tonight.
I just want to say for anybody out there who may be watching this, the auction is open to anybody from the general public. It's really easy. You stop by, you get a bidder's paddle, and you put it up. So there are a lot of folks that come. Families go in on an animal together. They'll split them. So I just want to encourage everybody to come and help support these young men and women. It's really worthwhile, and you're not going to get any better meat anywhere. So, thanks.
Well, thank you for coming and sharing your experience with us. Wonderful, wonderful. Okay, we're going to move on to the minutes of the past meetings.
Mr. President, I move for approval of the minutes of April 11th, 16, 25, and 28.
Yeah, do we have a second for that?
Second.
Thank you. Dee?
Director Wallace.
Aye.
Director Stewart.
Aye.
Director Nicholson.
Aye.
Director Epen.
Aye.
Director Danielson.
All right. Moving on, are there any oral communications tonight?
There are not.
Okay, thank you, Dee. Dr. Tsoi? Hi.
Hi. Here to present the credential action items. Our new appointments include the following. Dr. Namrita Boparai of Internal Medicine, Dr. Benjamin Deaton of Critical Care, Dr. Renu Gandhi, Allergy and Immunology, Pediatrics, D.O. Joshua Lin, Internal Medicine, Dr. Lakshmi Manchaneni, Internal Medicine, Dr. Anita Moon-Grady, Pediatric Cardiology, Imran Siddiqui, Internal Medicine, Dr. Hanti Tran, OBGYN. Temporary privileges are being extended to the following: Dr. Namrita Boparai, Dr. Benjamin Deaton, Dr. Joshua Lin, Dr. Lakshmi Manchaneni, Dr. Anita Moon-Grady, and Dr. Imran Siddiqui. The following are the 2-year reappointments. Dr. Eric Cohen, OB Hospitalist, Dr. John Kniff, Internal Medicine, Dr. Sunil Dewan, Dermatology, Dr. Harpreet Dillon, Internal Medicine, Dr. Joy Doyle, Family Medicine, Dr. Darren Fiore, Pediatric Hospitalist, Dr. Brian Jin, Pediatric Hospitalist, Dr. Elizabeth Jokerst, Family Medicine, Dr. Prasad Kata, Endocrinology, Dr. Kishore Nara, Physical Medicine and Rehab, PA Amy Nguyen, Physician Assistant, Dr. Joseph Schwartz, Family Medicine, Dr. James Thomas, Internal Medicine, and Dr. Jesse Zhang, Pathology. Under 1-year reappointments, we have Dr. Yaga Kapila, GI, and Dr. Gloria Yu, Pathology. Under non-reappointments, we have Jordan Ziegler, Neurointerventional Radiology. Under transfer and staff category, we have PA George Bryan and PA William Gadi, going from provisional to allied health professional. We have Dr. Brian Jin, Dr. Andrew Goldberg, and those two are going to provisional to active. Then we have Dr. Yaga Kapila going active to ambulatory. We have PA Amy Nguyen going from provisional to AHP. We have Dr. Mihir Patel going provisional to active, and Dr. Jonathan Wong going from provisional to active. Completion of proctoring and advancement staff category include the following. PA George Bryan and PA William Gade are going from provisional to allied health professionals. Dr. Brian Jin, Dr. Andrew Goldberg are going provisional to active. PA Amy Nguyen is going provisional to allied health professional. And Drs. Mihir Patel and Dr. Jonathan Wong are going from provisional to active. Addition of physician supervisors include Dr. William Gade with Dr. Tang Li, PA Lance Hine with Dr. Tang Li, PA Yukfeng Li with Dr. Tang Li, NP Richard Katavis with Dr. Benjamin G, NP Hang Tran with Dr. Benjamin G, and Christopher Wilkins with Drs. Mei-Shin Lee. Completion of proctoring prior to eligibility for advancement in staff category include Taylor Moore and Gates, MD, with moderate sedation, and Dr. Andrew Phillips, intensivist critical care. Deleting privilege requests include Dr. Janelle Bennett, deleting internal medicine, Dr. Catherine Dow, deleting EP privileges, Dr. Prasad Kata, deleting I-131 therapy, Dr. Kishore Nara, deleting assisted surgery, PA Amy Nguyen, deleting cast and splint after on-site evaluation by the supervising physician, and PA Christopher Wilkins, deleting assisted cath lab. Under resignations, we have Dr. Scott Merrick, Dr. Ricardo Molina, and Dr. Michael Parmley. That's the end of my report. Thank you.
Thank you, Dr. Tsoi. Can we have a motion for?
Mr. President, I move for approval of the credentialing action items as presented by Dr. Choi.
Thank you.
Second.
Okay, Pete?
Director Wallace.
Aye.
Director Stewart.
Aye.
Director Nicholson.
Aye.
Director Eben.
Aye.
Director Danielson.
All right, thank you. Okay, we're going to move on to the Service League report. Jeannie?
Good
Aye.
evening. Great month last month. Thank you so much for the Volunteer Appreciation Luncheon. Everybody that's given feedback, it's all been wonderfully positive and they're very grateful. So thank you for those that were able to attend and for your kind words. Masquerade fundraiser was last week, I think it was. Great turnout. And one of the neat things about it being part of the community is that people will come to shop and we say, you know, thank you, this is a fundraiser for the hospital, and they say, I just love Washington Hospital. And it's nice when you don't go asking, you know, what do you think of our hospital? They just offer that because it's genuine. So it's a neat way to engage with our community. So I'm just thankful for the staff that supported us, came out and shopped, as well as people in the community. And then, yes, this week, Monday and Tuesday, we had our annual Health Career Scholarships. The Service League has been giving out scholarships to students that are studying any field in the healthcare range. And this year, we had 3 scholarships to give. 2 are renewable $1,000 a year scholarships for 4 years, provided that the students keep their grades up and stay in the healthcare field. So there were 2 gals that just, the cream just, even though we have this incredible pool of students, everybody just seems to just all choose the same students. And so these 2 gals kind of rose to the top. One of them getting the 4-year scholarship, her name's Parishkrita Srivastava, and she's going to be going to Cal, studying integrative biology. I don't know what that means, but she wants to be a surgeon. She's co-president of the Medical Explorers program here at the hospital. And the second one winning a 4-year scholarship is Jenny Yang, and she's studying nursing at Dominican College, and she is birthing center volunteer that goes and takes snacks to mom, and she's given over 200 hours doing that. And then our third scholarship awardee is receiving a 1-year $1,000 scholarship in honor of Anna Ilola, our former director of volunteer services. And his name is Niall Almeida, and he won a 4-year scholarship before, and he's finished college, and he's going to Oklahoma University College of Medicine, and he wants to be a physician. And I just wish we could just tie little ropes to these students and make them promise to come back to us. But it's such a privilege to support them and encourage them, and they are a great inspiration to all of us. It's like, we're going to be okay. Yeah. There's great hope. There's got this caliber of students that are going out there and replacing all of us. So it's great. So that's it. Thank you.
Well, thank you, Jeannie.
Mm-hmm.
Thank you. Okay, we're going to move back to the medical staff report.
Okay, so I'm happy to announce that we have 346 active members of the staff right now and 590 total members.
Okay. Did calendar? Yes.
Yep.
Past health promotions and outreach events. On April 12th and 26th, Dr. Victoria Leapart, gynecologist, presented Stress Management. 14 people attended. On Saturday, April 14th, Washington Hospital hosted the 12th Annual Women's Health Conference. The event featured topics on female-specific stroke risk factors and prevention, an overview of improving your health and quality of life through surgery options, along with tips for women to take action to discover a confident, healthy you. 27 people attended. On April 17th and 24th, Melissa Reyes, RN, provided a two-part education series on stroke. Part 1, Stroke Prevention, educated community members about prevention, symptoms, and what to do if you are experiencing signs of a stroke. Part 2, Life After Stroke, provided an overview to better understand your condition and how to move forward after a stroke. 22 people attended. Also on Tuesday, April 17th, Dr. Amir Daska, podiatrist, presented Sick Feet, a health and wellness seminar about caring for your feet and treatment options through the Washington Center for Wound Healing and Hyperbaric Medicine. 17 people attended. On Thursday, April 19th, as part of the Mental Health Education Series, Dr. Simone Madan, PhD, UCSF, clinical psychologist, presented When Depression Occurs with Other Medical Conditions. 43 people attended. Also on Thursday, April 19th, as part of the Women Empowering Women series, Dr. Victoria Leapart presented Reclaiming Your Confidence, Body Image and Self-Esteem. 11 people attended. On Saturday, April 21st, Washington Hospital's Green Team, the City of Fremont, and other local Tri-City organizations hosted the Let's Go Green Together event. This free Earth Day Education Expo raised environmental and climate literacy awareness and shared eco-friendly ideas with people in our district. Attendees learned about recycling and how to save energy. Attendees also learned about planet-friendly options available for everyday living. An estimated 1,100 people attended. Also on Saturday, April 21st, Lucy Hernandez, Community Outreach Project Manager, Michael Levitt, Respiratory Care Coordinator, and special care nursery staff provided information on health-related programs and services during the March of Dimes 5K walk at the Alameda County Fairgrounds in Pleasanton. More than 200 people visited the health information booth. On Wednesday, April 25th, as part of the Speakers Bureau program, Christy Caracappa, Health Insurance Information Service Coordinator, presented Medicare options to the members of Better Breathers Support Group in Fremont. 28 people attended. On Thursday, May 3rd, as part of the Mental Health Education Series, Michelle Williams-Smith, Senior Family Advocate, Family Education and Resource Center, and Dr. Victoria Leapart presented Mental Wellness. 47 people attended. On Friday, May 4th, Washington Sports Medicine provided athletic trainers and hosted a first aid booth at the Special Olympics track tournament at James Logan High School in Union City. 616 local athletes participated in this event. Upcoming health promotions and community outreach events. On Wednesday, May 9th, from 6 to 8 p.m. at the Washington Township Medical Foundation Newark Clinic Conference Room, Dr. Harpreet Dhillon, Internal Medicine, will present Strategies to Help Lower Your Cholesterol and Blood Pressure. This seminar will also be presented at the Nakamura Clinic Conference Room in Union City on Tuesday, May 22nd from 6 to 8 p.m. On Thursday, May 10th from 5:30 to 7 p.m., Washington Hospital will host a skin cancer screening event. Individuals who have previously had skin cancer, one or more irregular moles, or a sore that will not heal are encouraged to participate. Appointments are available for screenings at this event. To register, please call 800-963-7070. On Saturday, May 12th, from 9 a.m. to 1 p.m., Washington Hospital will participate in the Age-Friendly Health Expo, organized by the Tri-City Elder Coalition. Washington Hospital staff will provide osteoporosis and blood pressure screenings, and Washington Township Medical Foundation will provide heart health information. Washington Hospital is also a sponsor for this event. On Thursday, May 17th, from 6:30 to 8 p.m., Michelle Williams-Smith will conclude the mental health education with her presentation on family support, caring for those with mental health disorders. Also on Thursday, May 17th, from 7 to 8:30 p.m., as part of the Women Empowering Women series, Dr. Victoria Leapart will present Stress Management: Secrets for Every Busy Woman. On Thursday, May 24th, from 7 to 8:30 p.m., Washington Hospital will host Celebration of Life. This event will feature stories of survival and hope for cancer survivors and their families. The event is co-sponsored by Washington Hospital, Hearst Breast Cancer Foundation, UCSF Washington Cancer Center, the American Cancer Society, and Tri-City Voice. On Thursday, May 31st, Washington Hospital will kick off the Family Caregiver Series. This 4-part series will provide tips and support for those who care for others. J.B. Goodyear, Spiritual Care Coordinator and Certified Meditation Instructor, will present Mindfulness Meditation for the Caregiver. On Friday, June 1st, from 1 to 3 p.m., Anna Mazet, registered dietitian, will present a fun, fresh summer cooking demonstration. On Thursday, June 7th, from 6 to 8 p.m. at the Washington Township Medical Foundation Newark Clinic Conference Room, Dr. Tam Nguyen, Family Medicine, will present Preventive Screenings. When and why are they important? This seminar will also be presented at the Nakamura Clinic Conference Room in Union City on Thursday, June 21st, from 6 to 8 p.m. Also on June 7th, from 7 to 8 p.m., as part of the Diabetes Matters series, Dr. Kuniyoshi Kanai will present InHealth. Dr. Kanai will discuss the increased risks diabetics have for developing eye health issues. Bay Area Healthier Together. Washington Hospital Healthcare System and ABC7 have launched a partnership called Bay Area Healthier Together. The aim is to raise awareness and educate our community and beyond about health issues like disease prevention, diagnosis and treatment options, and overall healthcare resources that are critical when navigating healthcare or health insurance systems. With resources, information, support, and insight, we can all be better stewards of and advocates for our health, and we can do it together. More information is available at bayareahealthiertogether.com. The Washington Hospital Healthcare Foundation Report. The Foundation hosted the 33rd Annual Golf Tournament at Castlewood Country Club in Pleasanton on Thursday, May 3rd. More than 180 golfers joined us for a great day of golf, games, and fun surprises. The trustees of the Foundation would like to thank the generous sponsors, golfers, and volunteers for making the tournament such a success. Proceeds from the tournament will support surgical services at Washington Hospital. The Washington Township Healthcare District Board of Directors Report. Washington Township Healthcare District Board members attended the Fremont Leadership Prayer Breakfast and the Music at the Missions Masquerade Ball on April 13th. District Board members also attended the Newark Chamber of Commerce's State of the City Address, delivered by the Honorable Al Nagy, Mayor of Newark, on April 19th, the Hearst Breast Cancer Foundation's People with Purpose Gala on April 21st, and the Citizens for Better Community Spring Celebration Gala on April 28th. Washington Hospital Employee Association, WIA. The Washington Hospital Employees Association is currently accepting scholarship applications for the 2018 Don Pickenpaugh Memorial Scholarship. Don Pickenpaugh was one of the longest-serving board members on the Washington Township Healthcare District Board of Directors. During his 27-year tenure, he served as board president 5 times. This $2,000 scholarship is available for dependents of Washington Hospital employees. Washington on Wheels WOW Mobile Health Clinic. The Washington on Wheels WOW Mobile Health Clinic has returned to the Tri-City area. For the past 5 months, the mobile health clinic has been assisting our neighbors in Santa Rosa, whose health clinic facility was impacted by the wildfires of last October. With a big thanks, the staff of the Santa Rosa Community Health Vista Clinic sent the WOW van home, where it will soon get back to serving the residents of our healthcare community. Internet and social media marketing. Washington Hospital's website serves as a central source of information for the communities the district serves and beyond. The hospital's About WHHS section was April's most viewed web page with 38,591 views. The hospital's social media presence is measured through total reach and engagement stats. The total reach statistic represents the number of people who saw a Washington Hospital Facebook post. Social media posts may reach a user via a newsfeed, which is most common, a user's page timeline, or via a direct link to a hospital post. The engagement statistic represents users who liked, commented, shared, or clicked on a Washington Hospital Facebook post. InHealth, Channel 78. During the month of April, Washington Hospital's cable channel 78 InHealth captured new programming, including 3 health and wellness programs titled Wound Care and the Latest Treatment Options, Stress Management, and Sick Feet, 2 Washington Hospital Experience programs featuring Washington Outpatient Rehabilitation Center and Washington Center for Wound Healing and Hyperbaric Medicine, and the Women's Health Conference. In addition, InHealth aired the Mental Health Education Series program called Understanding Psychotic Disorders and the April Board of Directors meeting. Awards and recognitions. For the 9th consecutive year, Washington Hospital earned the Practice Green Health's prestigious Green Health Partner for Change Award. Practice Green Health is a national organization with goals to encourage institutions in the healthcare community to commit to sustainable, eco-friendly practices. The Green Health Partner for Change Award recognizes healthcare facilities that have implemented a significant number of environmental programs, along with continuously improving and expanding upon these programs on the path to sustainability. Washington Hospital and members of the medical staff, including Washington Township Medical Foundation physicians, were recipients of the Best of Fremont 2018 awards and honors. Readers of the Bay Area News Group newspapers cast votes online to determine recipients. The 2018 Best of Fremont winners are Best Hospital, Washington Hospital Healthcare System; Cosmetic Surgeon, John Romano, MD; Best Dermatologist, Sunil Dewan, MD; Best Doctor, David Chang, MD; Best OBGYN, Elizabeth Kirkjohn, MD; Best Orthopedic Surgeon, Alexander Saw, MD; Best Ophthalmologist, James Song, MD, and Kenneth Lowe, MD; Best Podiatrist, Lawrence Elner, DPM. In addition, several physicians were also honored. The 2018 Best of Fremont honorees are Cosmetic Surgeon Ario Barzin, MD, and Eric Okamoto, MD. Best Dermatologist David Gorsalowski, MD, and Robert Roth, MD. Best Doctor Diane C. Martin, MD, Alexander Saw, MD, and Catherine Saxton, DO. Best OBGYN Women's Health Specialist Victoria Leaphart, MD, Stacy Berry, MD, and Nita Patel, MD. Best Orthopedic Surgeon, John Jaragito, MD. Best Pediatrician, Susan Dugoni, MD, Ali Halajpour, MD, Peggy Fang, MD, and the Southeast Bay Pediatric Medical Group. Best Ophthalmologist, Stephen Anderson, MD, and James Cohn, MD. Best Podiatrist, Joshua Van Gompel, DPM, and Warren Johnson, DPM. On Tuesday, May 1st, Jean Morgan, Director of Community Outreach for Abode Services, presented Washington Hospital and Washington Hospital Employee Association certificates of recognition for their continued support and volunteerism. These certificates are signed by Senator Bob Wachowski and Assemblymember Bill Quirk of the 20th Assembly District and Kansan Chu of the 25th Assembly District. Jean said it is an honor to work closely with extraordinary volunteers who make a difference in our community. For more information on any of the programs mentioned, visit WHHS.com or call 800-963-7070. And please follow us on Facebook, Twitter, Instagram, and YouTube.
All right, it's my pleasure to also present to you tonight the May Employee of the Month, Tran Nguyen, Staff Nurse 3 from 3 West. For the past 20 years, Tran has been part of the team of nurses at Washington Hospital. The word team is appropriate because Tran has a deep commitment to the teamwork on 3 West that results in patients receiving the best care possible. She was very surprised to receive the Employee of the Month award because Tran feels that she is surrounded by coworkers who go above and beyond to work together to provide the patient-first ethic each and every day. The nurse manager of 3 West, Harold Smith, however, knows this award is well-deserved. He says, Tran contributes to the team in many ways. She has an upbeat, positive outlook, which is important, and she often acts as a mentor to newer nurses and recent grads. Trang began as a per diem in 1998, but after only 1 month, Alice Santos recognized something special about her and offered her a full-time position. Over the years, Trang has honed her skills through specialized training and various hospital projects. One of the special things about Trang is that she understands that working in healthcare is an honor. She says, "I love my job. I enjoy being part of a patient's healing process. When I provide care and see improvement, even just a little bit, I know I have contributed to that healing." Being part of a team may have developed at a young age. Trang is one of 8 children. In addition to Vi, her husband of 23 years, and her 3 children, Trang spends a lot of time with extended family. Every other weekend, they get together and cook a big meal. Putting together a meal for more than 25 people takes another form of teamwork, but that's nothing new to an expert like Trang Nguyen. Thank you.
We're going to move on now to the lien report. John, there you are.
Yeah, I just want to say a few words about John Lee. Most of all of you know he's our Chief Information Officer. John received his undergraduate degree from the University of California, Berkeley in 1996. He also received a certificate in computer networks from Coleman College in 1997. His professional career includes information technology management positions at National Pen Corporation, Rancho Bernardo, Celerity Incorporated in Milpitas, California, and Purple Communications in Rockland, California. During his time at Celerity, a semiconductor equipment manufacturing company, John was promoted to Vice President of IT, where he was responsible for worldwide IT operations and systems, including maintenance and upgrades of Oracle Corporation's Enterprise Resource Planning solution used for manufacturing and financial management system. John joined Washington Hospital in 2010 as Director of IS Infrastructure and Technology. In 2013, he was promoted to Senior Director of IS Infrastructure and Technology, and in 2015 was named Chief Financial Officer. In his position, John oversees information services operations, including communications, telecom, infrastructure, client services, security, project management, and applications, including our Epic electronic health record. He also serves on the Hospital Ops Improvement Committee and is co-chair of the Privacy and Information Security Committee.
Thank you, Kimberly. It's my pleasure to speak with you this evening about our lean journey in the Information Services Department. And specifically, the lean methodology for us has really driven a positive and successful experience for our deliverables, and I want to share that tonight. First, a little history. So we adopted the ITIL and ITSM frameworks for our Information Services Department back in 2010 to 2012. So this is really where we started in on a standard work methodology for how we're going to handle incidents and responsiveness to issues. We also implemented our service manager solution at that time. A lot of this was done in preparation for the hospital's implementation of our Epic electronic medical record system. Then in October of 2014, the hospital launched its lean journey, and Sandy Adcock, who is in charge of our revenue cycle team through IS, who we share, thankfully, with the finance organization. Mark Moran and I were part of the initial training cohort that went through a process to become lean certified, and Vicki and Michelle, also on my team, were part of that second group. So we started in on discovering a little more about what lean is all about. And then our team started participating, our members, on numerous Kaizen workshops. So these were the workshops that began in different clinical areas, the emergency department, the operating room, and really got us involved with what lean is and how IS could contribute to that process throughout our team. And what we were really doing at that point was helping to enable solutions that we were coming up with through those team activities, and focused on obviously the technology and automation that we could help provide through the Epic system and some other systems that were in place. So with that going on and continuing to go on, we decided within IT we wanted to launch our own initiative within the IT organization. So in January of 2017, we established 13 teams focused on intra-team process improvements. So we focus first on 5S, which means to sort, set in order, shine, standardize, and sustain. So this is a initial launch that we've talked about previously that really focuses on getting your work area in order and making sure that things are standardized and ready to go. So it's just an example of all the team meetings that we launched through this process. We launched 13 visibility boards. And again, I mentioned these weekly meetings. So you can see as an example, each board is a little bit different, but has the primary standards that we're looking for. And I'll go through some of those right now. So we were building an attitude of sharing and contributing ideas, which is central to what we were trying to build within our team structure. So if you could see a little bit on this board as an example, we have a prioritization area for those ideas. We allow our team members at the front line to discuss their mood and what they feel their 5S score is for their group. We have some standards for that built in. But really the ideas are centered to what is being discussed in these 15-minute, once-a-week meetings where we go through and say, what improvement can we go after? What are things within that sub-team that we can make an improvement to so that our customers can benefit, so that we can get things done more quickly and really bring that frontline knowledge to bear on improvements, so it's not all a top-down approach. We utilize everybody's ideas throughout throughout our department. And so we rolled out those lean boards and had those meetings. While that was going on, Mark and I and Vicki and Michelle continued our journey to become lean certified leaders. So we're getting more educated, and as a background on that, you know, the lean certification process is a 12 to 18 month process. It requires proficiency in those concepts, and it really enabled Mark and I to, again, lead some of these Kaizen events, help us to understand what does it mean to go through a 5-day process to be the team leader or be the workshop leader to implement a solution for an area, and how could we then take that and utilize that within our own IS infrastructure. And so building that knowledge base was critical as we continue to try and grow our team to understand more about what lean concept could do for us here in the hospital. And so we said, okay, we need to advance our lean training for all of our staff in order to get them really focused. We have these boards going, but we also want to have expand that and do more with what this is than just to have a discussion about, these ideas. We want to take it one step forward. So in September of 2017, we launched a series of 5 classes, which were conducted by our IS management team, and basically went through and had 5 different topics covered. I mentioned the ITSM and ITIL, the language of lean, so make sure we were all on the same page, the 5S essentials and other lean basics, and then mistake proofing, which really is something focused from an IT standpoint. Where can we automate things? What could we do to make improvements that are technical in nature? And then, of course, standard work, which is at the base of all of this. If we can have that standard work documented, then that's going to have a consistency built around how we are always attacking the challenges that we have. And so we had over 75 employees trained through that process. So another concept that we launched after we had these smaller team meetings around those boards, we realized, okay, some of this can't be done within these smaller groups that we had created. We need to really break down these silos just like we do across the organization through the Kaizen events, and we need to do that through a mechanism. And so we said, okay, now we can do this roll-up board, which enabled us to have ideas come from any of those groups up through and to the management team, and then we could look at those and say, all right, this is a wider initiative than just your group can handle. We're going to take that on. We're going to use the Plan, Do, Check, Act improvement methodology that the hospital has embraced, and we're going to make every attempt to make an improvement that's broader based for our entire department. And so we started taking those on as well. Through this process, we've really come up with several hundred improvements, and some of them are smaller in nature, but each one contributes to an improved efficiency and productivity of our team. And so I've listed a few of them up here today. Just to call out a couple, the improved Nova Note review process, which is down towards the bottom, that really refers to every time we do an update to our Epic system, we have to review hundreds of notes to see what's changed, what impact it might have, what value it may have. And so by condensing that process, we're able to go through and really maximize our resources to get the best value out of what those notes are, and then not spend as much time on some of the pieces that aren't as critical, so that we can get that done and therefore save money and have a better result. So that would be the example of one. Obviously, some of these other ones with respect to cleanup of areas and project standardization, I'll talk a little bit more about later. So really, lean project benefits are where things come to head. So we go through this process, we enable our frontline board, and we get to a point where we've developed a common language and a lean framework that provides faster and better solutions, less interruptions for the business. And I looked back and I said, okay, well, what can we measure to show this? And so, like for instance, we did a double upgrade of the Epic system in 2014, and we did another one in 2017. And if you look back at our statistics, we had 59% less issues after the second one than we did the first one. And I credit a lot of that to the lean process. We also have had several projects, including those upgrades, where we have had a reduction in our cost, because what we're able to do is use internal labor through the language of lean, where people can communicate more effectively and efficiently, so we don't have to bring in external expertise as much, which can be double the cost, and we can really have a broken down silo effect so that we can use the information that we have effectively and come in sometimes several $100,000 under budget on some of these larger projects. And that has been true on multiple occasions. So we're very proud of that, and continue to look for opportunities to do that. So currently, for instance, we're managing 30 active projects. Some of those, just to call out, our larger ones right now are the Beacon implementation, which is currently on track. That's our oncology module that's going in, and it's scheduled to go in at the end of July, and we're utilizing some of that. We've utilized team members from our Willow team, which is pharmacy, and our ambulatory teams to function on that implementation, and they're utilizing lean concepts there, as well as of course, the Morris Hyman Critical Care Pavilion technology improvements. There are really a laundry list of things that have to be done there to integrate that new building, and so we're actively working on those. So we have a large project site and 5 other sub-sites that are tracking all the different pieces of that have to fit together to make that building work from a technology perspective. So we definitely see lean contributing to that as we build in the future. A couple other items that we're working on include our intranet site improvement effort, aligning our project task deliverables so that we can maximize, again, what we can bring forward in terms of a resource utilization improvement, and then removing waste, again, from some of our key processes, including service desk intake and change management. So it's that continuous improvement effort which is driving down our resource constraints and helping with cost. So in conclusion, our journey has been a great benefit to our own internal process and the ability to serve customers within the healthcare system. We feel that by providing clinical staff with faster and better solutions, we can overall enhance the experience of patients, and the clinicians can spend more time on patient-focused priorities and less on computer issues and things like that. And obviously, we'll continue to utilize this lean methodology. We're excited about rolling out additional things and to take our concepts of these boards and our abilities that we've been able to build within IS to go broader and get more out of further stuff with other departments going forward, like we've been able to do with the Kaizen events, but even lead those more and break down more barriers and hopefully save more cost and continue to deliver. So that's really our story, and I would welcome any questions.
Question? No. Wonderful program that we've been, now is it 5 years? 6?
About 3 to 4 years now.
3 to 4 years.
Yeah.
Yeah.
Just wonderful. Thank you,
great.
John.
Thank you.
Yeah.
Okay, next is a construction report.
Mr.
Ed?
Fan.
Yep.
Okay, so we have, again, a continuing look at a project that's coming to completion. So nothing new to really report here that I reported the last several times, which is our change orders on the exterior connections being the things that are driving the end of the project. This gives you a look at some of the x-ray rooms that are in the emergency department. So this is a CT scanner. The CT scanning equipment's been delivered and is in the process of being installed right now. This is one of the x-ray rooms, which basically its installation at this point is done. There's 2 of them in there in addition to the CT scanner room. The glass atrium, this is the last section that's being put in place, and you can see there's also lighting that's involved in this. That'll be lighting for actually the Morris Hyman statue that will be at the base of the atrium. You can see that the wood trim is going in around the elevator lobbies. It's on all floors. It's going in here. You can see on the first floor. This gives you a shot of one of the planted areas in the garden, so you can see that section is being completed. It's not all the way done throughout the whole second floor, but it's getting there. This gives you a look at one of the atriums that's in the center. 2 of these are in the center of the 3rd floor with the patient rooms around it, so you can also see that those plantings are being pretty well wrapped up. And we're still in the concrete phase around the loading dock in the back. And also, well, this is also the back end of that loading dock, and you can see the connecting corridor. They're starting to put the studs up for the wall to enclose that corridor space. This is the canopy area that will connect the building on the 1st floor over to the 1st floor main lobby in the Hyman Pavilion. This was the last area that was freed up. As you might remember, that we had the kitchen, mobile kitchen there. That was removed in early April, and they're already well into putting in footings for the canopies to be connected. This is the back of the Hyman Pavilion, and you can see that area getting cleaned up and wrapped up. This is the retaining wall that will hold the sidewalk and be the curb for the street, or the driveway that will go to the back all the way to the parking garage. This gives you a feel for here. The retaining walls have already been poured. The forms are still there. If you look out there today, a lot of the forms have been stripped away, and you have retaining walls in the beginning of that driveway taking shape. This is a shot of the same thing from above. But you may want to pay attention to this as you walk out tonight or tomorrow. And that gives you our update. So we're still trending towards time being done on time. Our substantial completion date has moved from June 11th to June 25th. But that's about it. Everything else is moving along okay. Budget-wise, we're in good shape.
Okay. Thank you, Ed.
Thank you.
All right.
We'll present the quality dashboard for the quarter ending March 2018.
Thank you. Good evening. So tonight I will be presenting all of our quality dashboard indicators for our first quarter of the year. Starting off with our core measure compliance. So of course this is the bundle of interventions that we do to prevent things like venous thromboembolism. So basically prevent patients from developing clots while they're in the hospital. And we continue to see good compliance inside the ICU and outside the ICU. We've been able to make sure that the 95% of the patients outside of ICU are getting all of the prevention mechanisms that they need to ensure they don't develop a clot, and actually 100% in critical care. This is a new way of collecting this over the last year, where this is information that is automatically being taken out of the medical record and submitted straight to CMS. So they're very strict about where the documentation is obtained from, and I think that we've done well on being able to get the documentation appropriately to reflect the patient care that we're offering patients while they're here. Moving into our stroke, because we are a stroke receiving center, we monitor these continuously in spite of Joint Commission not requiring it right now on a public level, but we've done well on all of the indicators, continuing to make sure that all these patients are getting the appropriate medications and teaching about the medications that they're going to be on when they go home. That will assure that they're preventing themselves from developing more clots. And these patients require quite a bit of education prior, especially if it's an initial stroke and their family members and everybody need a lot of support at the bedside prior to discharge. So we watch to make sure that they get all of the standard education prior to leaving. We've been able to do that for 100% of this population before they leave. And the patients also have to be assessed for rehab because, of course, this can affect your mobility. And we have an algorithm in place to make sure that these patients are on a list to make sure that our PT gets in there and does the assessment on rehab. This quarter, we did have a patient, unfortunately, that did not get assessed for rehab, and that's why you have a 98% compliance there. It's actually one patient, and the patient had great mobility in spite of this minor stroke, and so that was documented throughout their medical record, so that therefore they didn't get a referral to be reassessed. So we're going to make sure that that gets documented better so that somebody is doing that face-to-face in spite of the patient having their mobility prior to leaving. So we'll be continuing to work on that. Moving into our infection prevention indicators, our central line associated bloodstream infections. These are patients who develop an infection in their blood because they have the medical device that is directly placed in their venous system, and we want to make sure that we're doing all prevention methods to make sure that they don't develop an infection because it's obviously a high-risk area and device that can lead to blood infections. And for this quarter, we actually had a lower than predicted rate by the Centers for Disease Control. And this is a reflection of one central line infection and med-surg. And even though it's just one, we take it seriously. The unit looks at it closely. We work with ID docs on it, so infectious disease doctors, and it comes back to the Infection Control Committee. We do a root cause analysis, say, what do we still think could have been some things that could have contributed to it. So even with just one infection, the unit looks at it very closely. We try to take the lessons from that to move towards preventing further central line associated bloodstream infections. So we're in a downward trend for that, which we're happy to report. Catheter-associated urinary tract infections. This has been a challenge for us over the last about a year and a half, and as you can see, it's sort of gone up and down. And this quarter, we did have a higher number of infections than the CDC thought that we would for a hospital of our size and type. And this is a reflection of 3 catheter-associated urinary tract infections. They actually were all in the critical care setting. So we're looking at that bundle, and it's like you can compare what was the type of organism that was in the urine to see if there was anything we can learn from it. Is there any transmission-based practices that we could have looked at to see, are we doing our hand hygiene appropriately? Are we using our barrier methods that when we place the line and how we maintain the line? These lines in critical care access many times a day, obviously, because these patients get a lot of medications. So there's a lot of variables to look at to see what possibly led to these collapses. And since there's 3, we're going to be doing the same thing with those, a root cause analysis to see if we can find any causes. Typically, when you have a hospital setting in critical care where there are individual divided rooms, with what we'll be having in the new building, you do decrease your risk of spreading any sort of a hospital-associated infection. So that will help us, obviously, with the move. The other thing that is going to continue to help us is the fact that nurses have the ability now to look at if the patient really needs to have this urinary catheter, and if they don't, with certain standards and requirements, they can discontinue this catheter on their own now, which is why we've seen this general trend for over a year now of decreased catheter-associated urinary tract infections. I'm hoping to see that go back down. C. diff, as you know, is something we've struggled with for over a couple of years, really trying to keep this spore out of the hospital and make sure that when patients do have this in their stool while they're here, that we initiate proper isolation, looked at strict hand hygiene methods that we've looked at with patients in this room, and we're cleaning all these rooms with bleach. Every patient in this hospital who is on any form of isolation, we just use bleach, which is probably your best disinfectant in reducing the spread of these infections. C. diff, this is 10 hospital-associated infections for this quarter, so we're just slightly higher than the predicted, but overall in general seeing a decrease. And actually since March, for example, for the month of April, we do not have any hospital-associated C. diff infections, so we're hoping that for next quarter we'll continue to see this decrease. It's hard to say what impacted this and what's helping us sort of go in this downward trend. And part of it is that our infection control team has been working very closely with lab to make sure that we're appropriately testing the right type of stool and that you're testing it on a patient who really truly requires and meets the criteria for C. diff testing. That is a recommendation that we received from an epidemiologist and some CDC guidelines, and I think that's part of what's happened. You don't want to be over testing and not really looking at true acute C. diff in a patient and treating it with antibiotics that may not be necessary. So we're looking at that whole process, and I think that we're seeing some good outcomes from that so far. MRSA, which is the methicillin-resistant Staphylococcus aureus, that has been very difficult to, in general across the nation, to keep out of patients' blood while they're in the hospital, especially in intensive care where they have devices that can attract this infection. We have had just a continued great streak with this. We have not had a single patient with MRSA in their blood since 12/16. So that's been very well sustained. It's great. It can increase length of stay. And if a patient's already got multiple illnesses and comorbidities, MRSA in the blood can be very dangerous for anybody, but especially that type of patient. So this is a great outcome for our patients. And the same thing with VRE. It's resistant to treating patients with vancomycin. So even with a big antibiotic drug like vancomycin, unfortunately, this can be very difficult when it gets in a patient's blood. And again, we've had 2 quarters in a row of having that be at 0. So I hope it continues in that direction. Surgical site infections. We monitor all patients in the hospital who have a colon surgery, and we monitor them for 30 days to make sure that they aren't developing any surgical site infections. This can be even oozing at the incision site, temperatures, anything that makes us think that site, if it opens up a little bit or anything, the CDC is very strict on what they call a surgical site infection, especially when you're dealing with the colon. We've had, this was the first quarter where we had 1, and that I think was out of 15 procedures. Abdominal hysterectomy, we've definitely had a good streak here also. We have not had any abdominal hysterectomy infections in patients for a really good sustained period of time since 12/16 all the way up to 3/18. Our nursing sensitive indicators were basically looking at falls in patients, and we monitor and take all falls seriously, but especially want to focus on ones where patients sustain an injury as a result. And for this quarter, we were at a slightly decreased over the past 3 quarters, as you can tell. And this patient, this is actually only 1 fall with an injury that just put us at slightly above what the benchmark is for this. And it was an abrasion to the patient's head. And these are taken very seriously also. We huddle, we look at them, what caused it, did we have all of our prevention practices in place, and what could we have done to prevent it. And one of the things that the nursing team has done well is really increasing the rounds. You have to be in these rooms. You have to be looking at the patients frequently, making sure that patients especially when you're getting them set up in bed for the night. Did they use the restroom before they went? Are they not in pain? Is there anything they need at that time? Because most of the time these happen when a patient is trying to get out of bed on their own. They want to sustain their independence while they're here, and so we're monitoring that closely. Joint Commission has standard national patient safety goals. especially related to the ability of teams to communicate in between change of shift, because that's where a lot of communication errors can happen, and falling out with the direct hand-to-hand off face that all disciplines do. It's not just nursing. And Joint Commission expects us to be able to do that at least 90% of the time and document it and make sure it's done and carry out any actions that were assigned in the handoff with the patient to make sure that they're getting the right care. And we're still at 100% for this quarter. That's done by direct observation of other staff watching the handoff process and documenting it. Same with patient identification. We've continued to be at 100% for that, making sure that the patient is identified, and you use two methods of identifying the patient before you do anything. A procedure, give a medication. When you are bringing in the patient to admit the patient, this is something that we have to watch very closely to prevent any, especially medication errors or procedure errors. Procedure timeout is a continued expectation that we've been topping out at. This actual quarter, we did not have any patients that, when we did direct observation, we didn't see any procedure with this where they did not do the timeout procedure. We looked in cath lab, and they'd go into medical imaging and just certain settings and areas for OR procedures. And the timeout is occurring, and most importantly, was documented also, because that's where we've had some of our challenges in the past. Hand hygiene is something that we continued to do above the national benchmark by Joint Commission is 90%. But you can see for this quarter, we came down significantly, about 78% of the time that we observed hand hygiene, which is by direct observation by a trained infection prevention staff member and various healthcare workers who have volunteered and been trained according to standards that are set by Joint Commission. And to even do the observation for hand hygiene, you have to test out with a Joint Commission test and pass it to make sure that you can that you're trained appropriately to go out and monitor this hand hygiene. So this drop we took very seriously. It went across disciplines. We didn't have one specific discipline that we could focus on for teaching. It was various disciplines, and the issue that we identified was they were all identified on the weekend. And I had a couple months ago hired a per diem infection preventionist who only had availability to work on the weekends. I said, that's fine. So, you could be here as an educational source for nursing on weekend or any other discipline. And while you're at it, can you look at the hand hygiene? Because that's an area we typically don't monitor. And this is the result. So that's was an issue to us that we took seriously. So some of it is what we refer to as Hawthorne effect, right? So on the weekdays and business hours, I think people recognize that they're being monitored closely, and we were able to identify a gap that maybe when we're not present, hand hygiene decreases. So she is doing extra education on the weekends, and everybody was notified right there at the time that they were observed not washing their hands. And the medical staff has been great at working with us. Dr. Martin's working with us to improve this. We will continue to monitor this over the weekends across all shifts. Night shifts in here, every shift's in here. So I think it's important for us to recognize, what this reflects, and we're working on taking action to make sure that we're offering the same level of quality. Even if you're in here on a weekend or whatever day of the week, you have to offer the same level of quality and opportunity for the patient. So it's an issue that we're working on. Moving into our readmissions, pneumonia. For patients who were originally diagnosed in the hospital as a primary diagnosis of pneumonia, we did have about 13.7% of those patients came in again within 30 days, which is 16 patients. Still puts us at the lower than the national benchmark for pneumonia. So we've held that right underneath the benchmark for the last 4 quarters. Heart failure, I think we're at the point now where we can say we've had some sustained success on reducing patients who have heart failure coming back to the hospital within 30 days. And again, this is for any cause of coming back to the hospital in those 30 days. We had 12 patients out of 71 that did, 12 encounters back in the hospital. This was actually over 9 different patients. That puts us at 16.9% when the national benchmark for this group is 21.6%. We've had quite a bit of work going on with the readmissions reduction committee, and our focus has been heart failure. That was the first disease state we worked with. So we've been doing quite a bit with making sure that all these patients, after they leave the hospital, get a phone call from us, and to see is there anything that they need while they're at home. Has home health been out to visit? Did they get their medications refilled? Did they make it to their post-discharge appointment? In addition to that, we have been working with also talking to family members when we can that are living with them and asking, what are some of the challenges you're dealing with at home, and trying to direct them and facilitate them to get back into their primary care if they need to. And I think we're seeing some of that. Pharmacy has worked very closely with these patients, also making sure that they understand the medications and they have the medications that they need before they go. So this could very well be a reflection of that. Patients who came in to the hospital with a heart attack, otherwise known as an AMI, we had 23 of those last quarter, 6 encounters back, which was 4 individual patients, but that was enough to put us above the benchmark. We had 16.3% came back from us, but I'm sorry, excuse me, 26.1 came back of our patients, and 16.3 is the national benchmark for CMS. So we recognize that this is something that we're going to have to work on. We, in fact, the readmissions committee, we were planning on looking more into the pneumonia direction for a next disease state that we're going to add, and AMI is probably actually something we need to be looking at closer in seeing this recent data. That's it for our quiz. Any questions?
Okay, thank you, Mary. Any questions, anyone? Thank you. Very good report, I think, mostly. All right. Kimberly, we're going to do the finance report.
Yes, Chris Henry is going to begin.
Okay, tonight we'll be looking at our operating and operational results for March 2018. And we'll look at acute inpatient statistics. We're challenged in the month. Average daily census in March was 15.9 below budget at 169.2. We had 1,085 admissions against a budget of 1,130. Patient days for the month were 492 below budget at 5,245. And our outpatient equivalent days were 81 below budget at 138. Our average length of stay for the month was 4.66, 0.42 below the budget of 5.08. Looking at utilization case mix index, which is the indication of the severity of the cases we saw in the month, came in at 1.457. We'd expected 1.531. Our deliveries for the month were pretty close to budget at 145. We'd expected 147. Surgical cases were 22 below the budget at 376. That includes our joint cases that came just 1 below budget at 142. We had 27 neurosurgical cases in March. We'd expected 33. Cardiac surgical cases came in 5 below budget at 4. Our cath lab procedures likewise were below budget at 348. We'd expected 385. Outpatient visits in March were 274 below budget at 7,740, and our emergency room came in almost at 4,500, about 225 visits lower than we expected. So again, volumes were challenged in March. Quick look at cath lab activity for the month. Really, cardiac procedures came in at 49%. Against peripheral vascular procedures that were 32% of the volume, followed by non-vascular interventional radiology and neurointerventional radiology. Looking at productivity, management really tried to flex to these lower volumes. Productive FTEs were 86.2 below budget at 1,307.8. We had 137.8 non-productive FTEs. That was 17 below the budget, giving us total FTEs that were 103.4 below the budget at 1,445.6. So pretty good flexing down, but didn't quite get where we needed to with our FTEs per AOB at 6.46 against a budget of 6.25. Quick look at moving into the financials. First, we'll look at our Governmental Accounting Standards Board presentation. This is the presentation used for our audited financials. Total patient revenue came in $20.3 million below the budget at $172,993,000. Let me start that over. $172,958,000 against a budget of $193,283,000. Our contractuals for the month came in at 76.16% against a budget of 77.09%, so that's better. We had a not so favorable payer mix in the month. Our government in the mix was high, PPO was low, but that was offset by some adjustments to our contractual reserves. As we're getting down towards the end of the year, we're honing those in. So we ended up with an operating net revenue of almost $2.7 million below budget at $42,181,000. Operating expenses for the month came in little over $2.4 million below budget. That includes our salaries and wages were almost $1.7 million below budget with our lower FTEs. Our benefits for the month came in $355,000 below budget. We had lower health and welfare claims in the month, and our supplies, came in at almost $550,000 below budget. So those really what drove that improvement in our operating expenses. And we ended the month with operating income about $228,000 below budget at $2.147 million. Non-operating income for the month actually came in $24,000 above the budget at $1,796,000. That included we had a small unrealized gain in our investments of $132,000 that helped out. So we ended the month with a total bottom line $204,000 below the budget at $3,943,000 from a GASB perspective. Quick look at our Financial Accounting Standards Board presentation, and this is the way it just takes a look at how the financial markets might adjust our financials when they're looking at our bond issues, for instance. Our operating income stays the same. There's no adjustments there at a little over $2.1 million. We pull out our property tax revenue that supports the debt service on the general obligation bonds and our small unrealized gain on our investments for the month. We end up with non-operating income from a FASB perspective about $109,000 below the budget at $308,000, and a total bottom line from a FASB perspective of $2.455 million, about $330,000 short of the budget. So that's March. Are there any questions on March?
No. Go ahead.
I will be presenting April 2018's numbers. They are continued to be challenged, as you will see in the presentation this evening. To begin with, gross revenue of $158.9 million for April was below budget by $27.9 million, or 14.9%, and below April of 2017 by $18.5 million. Inpatient gross revenue of $115.9 million was below budget by 25.8, or 18.2%, and $15.3 million below April's of 2017. Also, outpatient gross revenue of $43 million was below budget by $2.1 million, or 4.6%. In terms of the major drivers of our revenue variance, as you can see, inpatient days were below budget by 946, and observation days were below budget by 94. The lower patient days drove the room and board revenue below budget by $7.6 million. Inpatient surgical volume was below budget by 49, or 15.6%, driving surgical services revenue $5.5 million below budget. The cath lab procedures were also below budget by 77, or 22.3%. This drove cath lab revenue below budget by $1.3 million. Emergency room visits were below budget by 494, or 10.8%, driving emergency room revenue $1.2 million below budget. And deliveries of 113 were below budget by 56, or 13.1%. This drove the birthing center revenue 1.2 million below budget. So the overall lower level of activity drove ancillary services revenue below budget by 11.1 million. Looking at the emissions, emissions were 11.6% below budget at 978. Emissions for the month were 33 below April of 2017's numbers, and the lower emissions were related to the lower deliveries and lower inpatient surgical and cath lab volumes that we talked about. Patient days of 4,599 were below budget by 946, or 17.1%. Patient days for the month were 610 below April's of 2017 numbers. As with admissions, the lower patient days were related to the lower volumes in the operating room, cath lab, and deliveries. Looking at our surgical trends, surgical cases in April of 354 were below budget by 53, or 13%. Surgical cases were 24 below April's of 2017 numbers. Inpatient surgeries were 49 below budget at 266. Outpatient surgeries were 4.3% below budget at 88. In terms of the surgical activity broken down, joint replacement surgeries were above budget by 8, or 5.3%. Cardiac surgical cases were below budget by 5, 38.5%. The neurosurgical cases were below budget by 14, or 48.3%. We did have 2 of our neurosurgeons were off for a period of time in April. And general surgical cases were below budget by 42, or 19.7%. Our cath lab trend for April, cath lab procedures for April of 269 were 77, or 22.3% below budget, and 83 below for April compared to April of 2017. Inpatient cath lab procedures of 114 were below budget by 59, or 34.1%, and outpatient cath lab procedures were below budget by 18, or 10.4%. Looking specifically at the cath lab activity, cardiac procedures were below budget by 2, or 1.6%. Neurointerventional radiology procedures were below budget by 13, or 92.9%. Non-vascular interventional radiology procedures were below budget by 27, or 38.6%. And lastly, peripheral vascular procedures were below budget by 35, or 25%. Deliveries for April, came in at 113, were below budget by 56, or 31.1%. Deliveries were 9 below budget, or below the numbers for April of 2017. Now looking at our non-emergency outpatient visits, came in at 7,087, which were above budget by 47. Lab visits were above budget by 128. Cardiac rehab visits were above budget by 65. Infusion center visits were below budget by 132. Emergency room visits were at 4,061, which were below budget by 494, 10.8%, and below the same period of last year by 458 visits. Looking at our preliminary productivity indicators for April, productive FTEs were below budget by 136.6 FTEs, which is 9.9%, which comes in at 1,247. Our non-productive FTEs were above budget by 1.1% at 180.4. Our total FTEs were 1,427.4, which were below budget by 134.7, or 8.6%. Our total FTEs per adjusted occupied bed came in at 6.79, which was above budget by 0.38. Looking at some of our other operational statistics, our Washington Outpatient Surgery Center had 474 cases in April. This was 24 or 4.8% below the budget of 498. Our clinic visits of 3,380 were below budget by 713 or 17.4% for the month of April. And was over a number of our different clinics in terms of Washington Urgent Care, the Nakamura Clinic, Newark Clinic, Warm Springs Clinic, and the Ohlone Clinic. Looking at our payer mix, preliminary payer mix information for the month of April. Government-sponsored patient revenue made up 73% of total gross revenue, which was above the budget of 71.9%. HMO revenue was 2.3% of gross revenue, which is below the budget of 3%. PPO revenue was 22% of gross revenue, which was also below the budget of 23.3%. And our private pay revenue was 2.7% of gross revenue compared to the budget of 1.8%. Looking at our key financial statistics and charity, days cash on hand for April ended at 176 days, up 3 days from March. Gross days of gross revenue and accounts receivable were at 53. And there were $356,000 in charity care applications pending or approved in April. So as you can see, our statistics for April continue to be challenged. The executive team is well aware of it and looking at initiatives in terms of diving into the numbers. So wanted to make sure that you were aware. We do understand that they are very much challenged.
Yeah. If there's anything good about it, is that possibly the district residents are, better shape.
Better shape.
Not so sick.
We hope that is the case, but as a team, we are looking into it.
Yeah, we certainly don't want them to be, our residents to be sick and not have the capability of getting cared for. So
right.
That's the key thing.
But it is something we definitely need to take seriously.
Yeah. Okay, we are now going to move on to our action items this evening. Dr. Stewart.
Item A. Mr. President, in accordance with district law, policies, and procedures, I move for the adoption of Resolution Number 1186, which calls for the district general election to be held in the Washington Township Healthcare District on November 6th, 2018, for the election of 3 board members, each for a period of 4 years.
Thank you.
Second.
Any
This is the standard resolution in terms of calling for the election.
Yes. Okay, Dee, please.
Director Wallace?
Aye.
Director Stewart?
Aye.
Director Nicholson?
Aye.
Director Epen?
Aye.
Director Danielson?
Okay, thank you. Motion passes. Item B.
Mr. President, in accordance with district law, policies, and procedures, I move for the adoption of Resolution 1187, which calls for the consolidation of the Washington Township Healthcare District election with the statewide general election on November 8th, 2016.
2018.
I'm sorry, 2000.
It's a typo.
2018.
2018.
Yeah.
Okay. I'm sorry.
That's okay.
We don't want to do a do-over.
Yeah.
I'll second it.
Thank you. Any questions, comments, anybody? Okay. Dee?
Director Wallace?
Aye.
Director Stewart?
Aye.
Director Nicholson?
Aye.
Director Epen?
Aye.
Director Danielson?
Okay, motion passes. Item C.
I may not have item C.
Oh.
Oh, I do. Sorry.
Yeah.
Mr. President, in accordance with district law, policies, and procedures, I move that the board authorize the chief executive officer to enter into the necessary contracts to proceed with the purchase of 5 replacement copiers for a total not to exceed $52,744.
Thank you.
Second.
We have a second. Kimberly, any comment?
You know, we've identified these 5 copiers. We need to replace them, given,
Yeah.
we need them for efficiency.
Yeah.
Yep.
Thank you. Dee?
Director Wallace.
Aye.
Director Stewart.
Aye.
Director Nicholson.
Aye.
Director Epen.
Aye.
Director Danielson.
Okay, that motion passes. Item D.
Mr. President, in accordance with district law, policies, and procedures, I move that the board authorize the chief executive officer to enter into the necessary contracts to proceed with the implementation costs for a total of not to exceed $479,231.
Second.
This has to do with the ADP upgrade.
Yes, thank you. We have a second. Any comment?
So really, this is, the ADP is our hosted services for time and labor management, staff scheduling, human resources, and payroll functions. It was implemented, we have the 2011 version, we need to upgrade it. This will allow us to optimize current configuration and implement new features. So it's time that we do this implementation for these key systems.
Thank you. Thank you. Dee?
Director Wallace.
Aye.
Director Stewart.
Aye.
Director Nicholson.
Aye.
Director Epen.
Aye.
Director Danielson.
Okay, thank you. That motion passes. Item E.
Mr. President, in accordance with district law, policies, and procedures, I move that the board grant approval for the inclusion of sales tax costs for the purchase of 4 giraffe warmers for the special care nursery. The sales tax amount not to exceed $8,411,000. I'm sorry. These are expensive.
We don't want to give that much tax away,
I was just trying to help state out.
It's still a lot of tax.
All right, sales tax not to exceed $8,411.31, bringing the total amount of the purchase to $99,344.36.
Second.
Have a second.
So in March of 2018, you approved the warmers, and we needed to come back with this additional tax.
Sales tax.
The sales
Okay.
tax.
Thank you. Dee?
Director Stewart.
Aye.
Director Wallace.
Aye.
Director Nicholson.
Aye.
Director Epen.
Aye.
Director Danielson.
Okay, that motion passes. Okay, at this point, we're going to adjourn to a closed session. Thank you. Okay, we're going to reconvene the open session and announce that there were no reportable actions taken during the closed session. With that, this meeting is adjourned.